When deciding to start daycare, do live school, or homeschool, first you have to understand what happens during a normal school year. My name is Dr. Monica Flores, a pediatrician in South Florida since 2001. Today we're going to talk about how to keep your child healthy as they start school this year and every year. Before COVID, every school year started the same. School would start, and for 2 to 3 weeks we had downtime at the office. Physicals were done, children were back in school full-time, and parents were working. By week 3 or 4, children would start coming in, a few at a time. Colds, runny nose, ear infections. The pace would pick up, and after Thanksgiving and through Christmas into February, our office would be full, and the children sicker. More fever, bronchitis, and pneumonias. Infants normally get an average of 8 respiratory infections per year. Once they enter daycare and school, this number increases to 8 to 12 per year. Why do the infections increase? There are more children together in one room. They share drinks and toys, and caregivers who wipe runny noses and don't have time to wash their hands in between. They love to hug and kiss each other. They pick their nose and wipe it with their bare hands. They bite their nails, suck their fingers, and wiggle loose teeth with their fingers to hurry the tooth fairy along. In August and September, we put our children in classrooms with 10, 20, 30 other children, where they start sharing their germs once again. Infants to children 6-8 years of age who did not attend daycare or go to preschool or even do live kindergarten will have no memory of what an infection is and how to fight it off. Not just COVID, but normal infections. RSV, adenovirus, H-flu, strep pneumo, coronavirus, the list goes on and on. The good news is our immune system is adaptable to the environment. What I have seen in the past is that these immunologically immature children and their teachers and caregivers will eventually catch up. They will have 6 to 12 months of constant illness, and then they will go back to being normal children. And caregivers, what can you do as a parent and caregiver of a school-age child to boost your and their immune system now and when they start school? Get sunshine, exercise, get plenty of sleep, pack a thermos of water and drink it. Sanitize hands before and after going to the bathroom and eating or drinking. Eat healthy. Fill your plate half with fruits and vegetables in every meal and snack. A quarter of the plate with protein and a quarter of the plate with whole grains. Avoid chips and cookies as snacks. Instead, pack and eat fruits, vegetables, or homemade protein bars. Don't forget to use a utensil instead of fingers to eat. Continue to mask even if vaccinated, and especially if you have any issues with your own immune system, asthma, allergy, celiac disease, arthritis, lupus, or other autoimmune diseases. Start on and stay on a multivitamin to round out nutrition. Do a saline spray or gel in the nose and brush teeth before and after school to clean out the nose and mouth. Treat any conditions that increase the risk of infection. Allergies predispose you to swollen nose and more mucus, which is more likely to hold on to infection. If you know or suspect you have allergies, even if you don't feel symptoms, do 1 to 2 sprays of a steroid nose spray like fluticasone in your nostrils every night. Consider an antihistamine like loratadine or cetirizine once a day, and talk to your doctor about a prescription anti-inflammatory like Montelukast. If you have asthma, make sure it's controlled. Do a baseline pulmonary function test with your allergist or pulmonologist and see if you need a daily controller medicine. And make sure to visit with your primary doctor and fill any medicines that you would need for emergencies. Treat eczema and keep open sores covered so you don't scratch or introduce infection through the skin. If despite all these things you or your child start getting recurrently sick, visit with your primary care provider. Ask for an immune workup to see if there's any individualized treatments that can boost your immune system. If the thought of 12 infections a year worry you enough to keep your child at home, still, go outside, get sleep, sanitize hands, keep them off your face, drink water, eat healthy, mask saline, vitamins, and brush teeth. Staying home will decrease the number of infections in a given year and allow your child to mature so that they keep their fingers off their face and mouth. When they are with their friends, their risk of infection will decrease. Stay healthy and happy today and every day.